Well, when it comes to mental health issues and care, each of our communities is affected differently. And today, licensed marriage and family therapist Eden Garcia-Balis of Airport Marina Counseling Services is here to focus on the mental health challenges facing the Black community. And we really want to talk about the general issue of race when it comes to mental health care. So let's talk a little bit about how it's different for Black people compared to other races.
Yes. So according to Mental Health America, mental health conditions in Black people occur at the same frequency as they do in white people. However, the Black and African American experience in America has and continues to be characterized by trauma and violence, which impacts the emotional, social, and mental well-being of this population. In addition to that, we also see that Black people when it comes to mental health, they experience more chronic and severe mental health conditions as opposed to episodic ones. And historically, oppression, dehumanization, and violence has evolved into individual, structural, and institutional racism, which leads to mistrust, as well as inadequate health care, which is a big problem in America.
Yeah. What about the difference in reporting the mental health problems?
So when it comes to prevalence, what we're seeing is that Black people in poverty are twice as likely to experience a severe mental illness as opposed to white adults. We're also seeing that Black and African American people report more feelings of hopelessness, of sadness, of being overwhelmed as opposed to their white counterparts. And then this statistic is interesting. Black people are less likely to die from suicide. However, Black youth are more likely to attempt suicide than white teenagers.
Wow.
So it's a big problem.
Yeah, and how do we go about bridging this gap and the differences?
That's a great question. So there are several things that we can do. One is increasing cultural competence. So by providing specialized training to clinical providers, they can learn strategies to working with marginalized communities and diverse populations. It's also important to diversify the providers by increasing the diversity of the workforce. People seeking treatment may feel more comfortable talking about their problems and building trust with someone of a similar cultural and ethnic background. And lastly, it's important to increase affordable options. So by building more equitable resources for people like we offer at Airport Marina Counseling Services, more people can get the help that they need. So at Airport Marina, we offer low-cost mental health services based on a sliding scale, so people pay what they can afford. We offer services 7 days a week, and they're virtual and in-person, so we can offer services to just about anybody in America, or actually anybody in California.
Okay, and it's important, no matter your race, that if you need help, you do seek help.
That's
Thank you so much. We appreciate it. And you can find more information about mental health services by just going to our website, kcalnews.com, and clicking Seen on TV.